Jimena 35 na legislatura in Guam is back from recess. Good afternoon, colleagues. When we last left, Senator Joseph Augustine still had the floor on the Moylan Amendment. Senator Joseph Augustine, are you okay?
Am I okay with the amendment?
Well, we're speaking on the amendment, sir, and then you asked for the recess. So I'm
Yes. I wasn't able to get any feedback from OSB and BBMR. They're working on the budget today, just to let you know.
okay.
All right?
Senator, anyone else on the Moylan Amendment? Anyone else? If not, there's been an objection, so I'll ask Senator Moylan, would you like to close or would you like to call for the vote? On the Senator Jim Moylan Amendment, there has been an objection. All those in favor of the Moylan Amendment signify by raising your hand. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6. Motion carries. On the main motion, or Senator Moylan, this is timeout. Senator Jim, you still have the floor unless you want to, thank you. Anyone else on the main motion on 323? Anyone else? It's Senator Therese Terlahi on the main motion of 323-35. Okay. Is there anyone else wishing to speak on the main amendment? I'm sorry, on the main motion. Anybody else wanting to speak on the question? If not, Senator Therese. I will acknowledge you. I apologize. You're the only one left. On the main motion, Senator Therese Terlahi, you are recognized. Thank you.
Thank you, Madam Speaker. I think I tried to upload 2 amendments. One was earlier, and I'll start with that. That one is a simple amendment. I looked through the list on the BPT form, and the only category that was not included in this bill was the profession prior to, my colleague's amendment,
Right.
To add rental other. So I would make a motion to add that word profession or professional. Profession, I think is what, sorry, I'm going to open the amendment. It should say FA 323 TMTP2. So that shows the rental others, but my amendment just to add that word profession, which is double underline.
Colleagues, if you're listening closely to Senator Therese Terlahi's amendment, she has profession added after rental others, comma. On the amendment, are there anyone wishing to speak? Senator Mars Taitano, you are recognized.
Sijus Masi, Madam Chair. I just wanted a little bit of information in case the author of the amendment has it. So in order to understand this, the same question that I had asked prior to a similar amendment, do we have the understanding, have they been excluded from being able to avail themselves of this tax exemption?
I will ask Senator Therese, would you like to yield?
I'll yield, but I don't know the answer, Madam Chair.
Thank you. Senator Marsh, the author of the amendment, does not know the answer to that. You still have the floor on the amendment.
Sijus Malasi, and I don't know if this next question is known yet either, but is there any understanding the size of the body who qualify for this category? That file as and fit within profession?
Thank you, Senator Taitano. Senator Terlahi, Therese, would you like to answer that question?
I don't know the size of the body, but I do know that when, for example, OFB was doing their estimates on the impact of this bill, they pretty much calculated businesses within the income levels, and I don't think they were narrowing it down by these types of categories. So I don't expect that it's going to increase the pool or the estimate.
Thank you, Senator Therese. Senator Taitano, you still have the floor.
Sijus Masi, Madam Speaker, and I appreciate the information from the author. As we've been discussing, it's important to understand these as much as possible, and any possibility of understanding just a little bit more is helpful. So the information that was shared I do find helpful, and I appreciate that from the author of the amendment.
Thank you. Anyone else on the amendment? Senator Luis Muñoz, you are recognized.
Thank you, Madam Speaker. I just wanted to ask the author a question.
State your question, please.
So in the GRT form, I just wanted to find out, is that exactly how it's written, as just profession as a general term, or is it singular, or, I mean, does it just read as just profession?
Thank you, Senator Luis. I will ask the author. Senator Therese, would you like to explain the meaning of the proffered amendment as it relates to definition of profession?
Yes, I would, Madam Speaker. Just if you give me 1 second. Sorry. Oh, sorry. 1 second. It says profession, yeah, so exactly like that.
Thank you, Senator. Senator Luis, does that suffice?
Yes, Madam Speaker.
Thank you. On the amendment, anyone else? If any objections of Senator San Augustine, I'll recognize you on the Terlahi amendment.
Madam Speaker, if the author could yield to a question, very simple question.
Please state.
What is the definition of profession or professional or whatever?
Thank you. Senator Therese, would you like to explain?
I'll yield, Madam Speaker. I was trying to find that in the code, and I don't see an exact definition, but it is listed as a separate category, and it just says, upon every person engaging or continuing within Guam in the practice of a profession, excluding those expounding the religious doctrines of any church. That's what they have under professions. That's in 26202.
Thank you, Senator Therese. Anyone else? Senator San Augustine, you still have the floor. Thank you very much. On the amendment, is there an objection? Is there an objection? Seeing or hearing none, motion carries. Senator Therese, you still have the floor on the main motion.
Thank you. I just wanted to just state again that this is the only category on the GR. Well, now I'm not sure because they break out other things that we tax differently, such as alcohol and different things like that. But it was on that same set of listing, this is the only one that was excluded, so I just thought it should be included. Thank you, Madam Speaker.
Thank you. I'm just also, for the record from the dais here, just note that we're talking about BBTs instead of GRTs based on the news, based on the citation now. So it's business privilege taxes and not gross receipts taxes anymore. Just want to make sure that it's noted.
Well, on the return, it says GRT. So yeah, I think they use the terms interchangeably.
Yeah,
Thank you.
thank you. Anyone else on the main motion? Anyone else? If not, Senator Joseph Augustine, would you like to close? Oh, Senator Therese, I do apologize, Senator Joe. She still wants to speak on the motion. You have a couple of minutes, Senator. You're more than welcome to speak on the main motion.
So again, Madam Speaker, I know, so this bill originally is supposed to benefit 517 businesses with gross annual income below $500,000, in addition to the 604 businesses under $250,000 whose taxes were reduced by Bill number 1. And of course, I support this assistance to the small businesses, as I did not support the increase in the business privilege tax that was passed last term from 4% to 5%. My concerns, of course, that I stated earlier, I still do have concerns that this is done. The timing of it is in advance of it's going to affect FY20 revenues and FY21 revenues, and we are really not saying, what's on the other side of that equation, how we are going to change our spending patterns in FY20, or how we are going to make up the difference in FY20, or how this will impact our FY21, revenue projections. Yeah.
Senators, please, we do have a colleague speaking, and I'm asking if you can please allow her the time so she can be heard on the floor. Senator Therese, you may still proceed.
Thank you. And so, we've asked, we have a fiscal note from BBMR that estimates $5 million. I think we were estimating for the amendment that passed up to 10 or 11 million that this might now impact. And, so there are some unanswered questions, I guess that's how I'll say it. But for months, the governor had told us that we could not afford to, maybe over a year now, she said we could not afford to reduce the business privilege tax that was raised. And, many of the businesses believed that was only raised temporarily. And as I said before, I did not support that increase. And I support repealing that as soon as we can. And I think that if we are able to find $30 million today, in one day, to, that we can cut out of the FY20 budget, which looks like we can if we can pass, this bill, the health insurance bill, the new bill that we're going to consider, all of those, make up 10 million each. That's about 30 million. That's already half of the 60 million that was estimated to come in from the change from 4 to 5%. And so I just believe that if we're going to benefit some of these businesses, then we should just benefit all of the businesses. And if, at first I thought these businesses, what I really want to benefit are the people of Guam. Because we've seen the businesses, and they've definitely suffered by closing, right? And they've impacted their employees. But it's those employees and those families that I am hoping that we can get this money to. We've seen, the federal government came in and tried to assist these businesses with the PPP and the Paycheck Protection Program, which was a loan, but on June 3rd, the media reported that 70% of Guam's small businesses received PPP, totaling $304 million. About 2,458 businesses received funds through the PPP. And the first round of applications, the average was about $206,000 each. And in the second round, about $79,000 each. The PPP, of course, it's been changed recently to allow more flexibility, and the previous legislation required 75% be used on payroll for loan forgiveness. So that was also a way for the federal government to not just give to the businesses, but to ensure that it's going to help the employees.
Yeah.
And, in addition to the PPP, about 258 Guam businesses also received about $18 million in economic injury disaster loans. In addition to those, $20 million was set aside from the Guam CARES Act money given to GITA to do a small business program where they also are supposed to distribute $20 million in grants, just grants, not loans, nothing to pay back to small businesses. So, at first I was trying to find a way to ensure that that this bill, how we are going to give this, reduce the taxes for these businesses was also going to get to those families. But, when we debated the rise in the BPT, the businesses, they told us any increase in BPT, we're going to pass it on to our consumers. And if we're going to pass it on to our consumers, that's, the impact on the families. And so I'm thinking if we're going to allow these families to participate in the, recovery of our economy and to just benefit all the way around from a decrease in BPT, that we should just, decrease the BPT. And so, is it uploaded now?
Yeah.
It's, all right.
Okay,
so,
Senator, I'm going to go ahead and address you.
Thank
You
you.
spoke previously. I'll go ahead and address your amendment right now.
Yes, so
So-
I'm going to proffer an amendment, and just give me 1 sec. This, while I'm waiting for it to open, so this amendment, is not opening for me, but it should decrease the BPT to 4% for all taxpayers for the same 2-year period that the bill is proposing to decrease it to 3% for just that limited pool of taxpayers. So that's labeled FA 323 TMT Section 2 PDF.
Does everybody follow the amendment?
Madam Speaker, yeah, I don't know if you've seen this, but I've seen this in many businesses that I go to where, doctors' offices, other places where they put up signs even, that because of the increase in BPT, we're going to add that to your bill, and different things where they're showing that they are really putting that to the consumers. And so I think it's fair that we're going to reduce it for everyone.
Senator, if I may, just because of the statement, I'm going to go ahead and call for a moment's recess.
What
because I
statement?
think you're saying that there was no, I thought that bill was repealed as far as showing the 4% GRTs.
No, Madam Speaker, I'm saying, yeah, I know what you're talking about, but some businesses still put these signs up. I've seen them, and so that I'm just saying that regardless of whether they're allowed to or not, it's very clear that they are passing their, privilege tax onto consumers. And they told us that when it was going to be raised, that was their predicted outcome, right? That would just raise the price of goods and services for all the people of Guam, Madam Speaker. And so, the downside is we can't guarantee that this decrease in business privilege tax, this or the original bill, would actually get to the consumers, but that is what the businesses testified, that the reverse, that if we increase the VPT, that it was going to impact the consumers.
Thank you, Senator. On the amendment, is anybody wishing to speak? Senator Joseph Augustine, I'll acknowledge you.
Madam Speaker, I object to that amendment. I objected even to the last one. If we're going to start talking about everything else that my colleague wants to do, introduce a bill and let's hear it. Let's have a public hearing and let's go through this. 323 went through a public hearing. Everybody testified that needed to testify. You have the committee report. It tells you what the estimated loss in government revenue. Does she have an estimated loss, or is she just going to be guessing as she goes along? Because I even objected to the last amendment. And that's why I object to this one. Thank you, Madam Speaker.
Anyone else on the amendment? If not, there has been an objection. Senator,
Yes, to address the
sorry, I
estimated
do
loss.
apologize. Senator Biscoli, I saw your hand. I apologize. You are recognized on the amendment.
Sister Smasi, Madam Speaker, I don't necessarily object to the spirit of the amendment. I think that, as a member of the previous body who also voted against raising the BPT to 5%, this is something that our community has struggled with from that time when we had to make that difficult decision. And there were a handful of us that stood in opposition to the increase. But we're here today, and it still doesn't negate the fact that an amendment like this significantly changes the entire bill. And many times when that happens, Madam Speaker, we challenge germaneness, we challenge a lot of other things. So I just wanted to have that inquiry and see if maybe we can speak to legal, take a recess and have legal look at this. This is a huge departure from the original intent of the measure, the original bill as it was heard. And so I just want to be respectful of our process and respectful of the rules that we all signed up to follow at the beginning of the term. This is outside of our rules and outside of the scope of amending certain things. I absolutely, again, I would support the intent and the spirit of this amendment, but I feel like it's not enough to do things, to do the right thing. We have to do the right thing in the right way. So with that, Madam Speaker, I'm just requesting a brief recess so we could speak with legal
Madam Speaker.
and get a little bit more
you.
information about this. Thank
We
you
are
very
in a
much.
moment.
Just a point of
Recess.
order, Madam Speaker, that if the
We are in recess. Y mina 35 na legislature in Guam is back from recess. At this time, ladies and gentlemen, I will acknowledge Senator Lee.
Madam Speaker, I think we're waiting for a ruling from you
Uh,
as to germaneness.
Based on the ruling received from legal counsel, I will, Senator Lee, do you have a point of information?
Honggen, Madam Speaker, I just wanted to
favor.
clarify that what I was attempting to state was not necessarily germaneness, but that this motion is materially different and would appreciate a ruling from the chair.
Yes, thank you, Senator Lee, and based on that, I'm going to rule on Section 102K of the standing rules that this is materially different. Your amendment is out of order unless you object, and
Yes, I would like to make a motion to, notwithstanding the rules, overrule the ruling of the chair, of the speaker.
of all those in favor of Senator Therese Terlahi's motion, signify by raising your hand. Motion fails. Thank you, Senator Therese. Anyone else on the main motion? If not, Senator Joe, you may close.
Madam Speaker, if I'd
Yes.
like to ask a motion to reconsider the Moylan's amendment.
On Senator Jim Moylan's amendment?
That's correct.
On that motion, is there an objection? There's an objection.
Dispensa, Madam Speaker, can we just identify which one it is? Because there were several amendments offered by Senator Moylan, so I just want to be clear on the vote.
Thank you. Senator Joseph Augustine, can you please state the amendment for reconsideration?
Yes, it was, let me see, it's on the drive, FA 323 JCM, page 2 PDF. It's ranging from 250 to 500.
On that motion, there was an objection. All those in favor to reconsider the amendment that's passed, please signify by raising your hand for reconsideration. 3, 4, 5, 6, 7. 1, 2, 3, 4, 5. Motion passes. Senator Joseph Augustine, you still have the floor.
You,
Yeah. So colleagues, the motion for reconsideration that was passed was up. For reconsideration, that motion passed. So I'm calling for a revote for that motion. All those in favor signify by raising
Can you
your...
state the motion, the amendment, the
He,
amendment?
Senator Joseph Augustine, I'd ask that you read the
No,
amendment.
it's his, we're reconsidering
Our-
his amendment.
Colleagues, the amendment was, from Senator Jim Moylan, was to increase from 250,000 to 500,000. That is the amendment. so that my colleagues understand. Colleagues, on the call of the vote, all those in favor of the JCM amendment to increase from 250,000 to 500,000 signify by raising your hand. 1, 2, 3, 4, 5, 6. Motion fails. Senator San Augustine, you have the floor to close.
Thank you, Madam Speaker. I just ask that Bill 323-35 COR, with its as amended, be sent down to the voting file and to include Senator Tello as one of the co-sponsors.
On that motion to add Senator Tadegui as the co-sponsor without any objection, hearing or seeing none, motion carries. On the motion,
That's it. No, that was it. Just move it
on the
down.
motion to place on the third reading voting file without any objection, motion carries. Colleagues, next on the agenda is Bill number 366-35 LS, placed on session agenda. Senator Pito Terlai, you are recognized.
Thank you very much, Madam Speaker, and good afternoon, colleagues. Madam Speaker, notwithstanding the House rules, I move to accept Bill number 366-35 LS as substituted on the floor. Madam Speaker, again, Bill number 366-35 LS introduced is identical to Bill number 255-35, which was publicly heard, then amended by the committee. Bill number 255 was placed on this session agenda, discussed, and was further amended by this body. The substitute that I present to this body is reflective to those changes.
On the motion to place the substituted version on the agenda,
Could we just have 1 minute to review the sub?
that's uploading right now. We will have a moment's recess. Legislature in Guam is back from recess. On the motion to accept, are there any objections? Hearing no objections, motion carries. Senator Pito, you are recognized on the main motion.
Madam Speaker, Dangkluna si Jesus Masi, pwede na oportunidad. I move to place Bill number 36635 LS as substituted on the floor on the third reading file, Jamalagod zone na may diskuti este na bill.
Consigue mo na, por favor.
Bill number 366-35 as substituted includes all the amendments agreed upon prior to Bill 255 withdrawal. Over the weekend, there has been many callers who have contacted my office as well as my phone and email. Colleagues, I know there are some reservations about the additional cost to taxpayers and its additional impact on taxpayers. But last year's exclusive contract was more expensive than the previous year that included choice. So are we sure that exclusivity actually achieved its intent? How many residents have been denied services that have been covered by other insurers in the past that had to be paid out of pocket by our subscribers? I know of an insurer that was awarded the contract based on the lowest price that still has millions of unpaid invoices at GMH and refuses to pay over $13 million in services at our private hospital. So is that cheaper, I may ask? Colleagues, colleagues of ours made the point that some taxpayers in Guam don't have medical insurance at all, and that was a problem. But we only have 12,000 government of Guam employees, but we have 31,000 subscribers. So undoubtedly, the government plan covers more than just our employees. Estimated by insurers is upward to 20%. That means that at least 5,000 or more private sector employees, sons and daughters under the age of 26, husband and wives are covered by the government health insurance plan. And I am certain that our contract has a positive effect on our local economy and not a negative one. Colleagues, I humbly ask that you join me in this hearing, and I will, the will of the people, that they want to choose their own doctors and medical professionals. They want to choose their clinic, and they want to choose their insurers. Sana maasi. Thank you very much, Madam Speaker.
Sizos Masi, Senator Terlai. On the main motion, Senator Lee, you are recognized on the main motion.
Sizos Mahasi, Madam Speaker. Madam Speaker, I just had a question for the proffer of this measure. While the substitute bill the motion for the substitute bill to be placed on our agenda was moving, there was a statement made that this bill that we're discussing now, the substitute bill, has all of the amendments intact. But there was also a statement that this bill was publicly heard. So I just want to clarify for the record, is what we're discussing the original bill that was publicly heard, or is it the bill with all the amendments intact? Because those are two very different measures, Madam Speaker. So I just would like some clarity on that.
The bill, Senator Terlahi.
Madam Speaker, you know, when we introduced Bill 255-35, we had a public hearing.
Yes.
And 255, along with the current bill that has been introduced, 366, is identical to the bill that we introduced initially, the 255.
The 255. The bill, the bill 366 has the amendments.
Is identical as amended, is identical
As the
to
bill
the
that was in the
introduction of the
committee.
255.
Yes, it was in the committee, Senator Terlahi, the amendments inclusive of the ones that were in the committee.
Inclusive of the amendment.
of
Madam
last week,
Speaker,
Friday.
on the
Yes,
255.
yes. Thank you. Senator Lee,
This is Osmasi, Madam Speaker. So I just want to again clarify for the body that this bill that we're discussing did not have a public hearing. This bill that we're discussing with amendments intact is substantially different from what was heard, Bill 255 that was heard. And that's the only point, Madam Speaker.
thank you. Anyone else on the main amendment? Anyone else on the main motion? Vice Speaker, on the main motion, I'm sorry.
Thank you, Madam Speaker. Just a point of inquiry perhaps for the body, with our clerks is this bill 366-35 has inclusive amendments that were originally done to Bill 255-35, which was withdrawn several days ago.
Yes.
So if the clerks, because we're looking back in the history of the drive, and there's no history of 255 ever being discussed. So can we please add back the history of bill number 255-35? Because if we feel that it is relevant to discuss and move it on session floor without a public hearing based on the history of it, the history of the content, then please add bill 255-35, everything that we put on there. Thank
Duly
you.
noted. Clerk's will work.
So can we just do a quick recess until the information is added back on?
We'll take a moment's recess to make sure it's included. Y minuto 35 in the legislature in Guam is back from recess. Vice Speaker Nelson, you still have the floor on the main motion.
Thank you, Madam Speaker. I'd like to reserve my time, please. That was just to do a point of inquiry.
Thank you. On the main motion, anyone wishing to speak on the main motion? Senator Sabina Perez, you are recognized on the main motion.
Thank you, Madam Speaker. I just have a point of inquiry for the author.
Please state your question.
So regarding on page 3, section 2, it states, of the remaining qualifying plans, the employee or retiree may, notwithstanding any other provisions of law, rule, or regulation, choose one of the remaining qualified plans. Any difference in premiums shall be paid by the employee or retiree at their own cost. So I guess the question would be, first of all, would this require the governor to contract with whatever qualifying plans that the subscriber chooses?
Can you restate the question, please? I didn't understand. I didn't hear that clearly.
Sure. So basically the way the bill is written is that should subscribers not would like to choose a different insurance provider other than what's selected by the governor, does that require the governor to contract with those insurance companies?
Senator Pito Terlahi, would you like to yield?
Madam Speaker, you know the bill is choice. So whatever the commission submit to the governor's office, because they're going to submit more than one insurance, so the governor has the final say-so to choose the option, the lowest option of insurance. The governor is the final authority to have that insurance be part of the Governor Guam insurance for Governor Guam employee subscribers.
Senator Perez?
I'm not sure if that answered the question, but I'll move on to the next question. The other thing is, by doing so, would that adversely affect the plan selected by the governor and that company's cost? That's my second question.
Senator Terlahi, would you like to yield?
I don't really understand the question, Madam Speaker. Can you repeat?
Sure.
Senator Perez, please repeat the question.
Okay, so the situation is, would that adversely affect the cost? So let's say the governor decides on a particular insurance provider, and there are people, employees that want to choose something that's different from what she chooses. So would that change the cost of the plan that the governor chooses?
It certainly may. I mean, Senator Terlahi.
Madam Speaker, whatever the governor chooses, that is not the only insurance. This is the choice insurance. So if a subscriber wants to choose another insurance, then of course the subscriber is authorized to actually sign up for that provider.
Senator Perez.
Yes, so for instance, let's say the majority of the employees are satisfied with the governor's choice, but there is a subset that do not want to be a part of that insurance. So how would that affect the costs for the majority of the subscribers that want that particular insurance provider? That's the question.
Minority Leader, do you have a point of information?
Yeah, point of information, Madam Speaker. Madam Speaker, as you know, the choice of health insurance companies, at least the two top 10, has been going on for decades in the government of Guam. And how it's proposed is that through the negotiating team, the negotiating team picks the top two economical, beneficial to the government of Guam. That is then submitted to the governor. And if the law states that the governor can have more than one or two best, or chooses two best proposals, that is already submitted to her. So the cost, which is bared by the employee, which is government and Guam employees would have to share into that cost, and the government of Guam shares into their cost in health insurance. So I'm not quite sure what the good senator from Barragata Heights is asking, but it all begins from the negotiating team coming up with their final decision and submitting it to the governor. And based on if this law were to pass, the top two proposals shall be submitted to the governor. And from there, the governor will go into a contract and sign it. Or she probably, if she doesn't want, she can go back to the negotiating team and saying, no, I don't agree with these two, and then they have to go back to the drawing board. But I don't think that's really ever happened before. So again, it's about what the most economical and beneficial healthcare insurance plans, two proposals submitted to the governor for her consideration. And if this bill should pass, it specifically states that.
And of course, Madam Speaker, if the governor chooses the lowest option, insurance, and if the subscriber wanted to go into another insurance, so let's say the second insurance, the subscriber have to pay for the
Premium.
the premium, the extra premium that provider is, asking for.
Thank you, Senator. Senator Paris,
Point of inquiry, Madam Speaker.
on a point of inquiry, state your point.
I just, the previous speaker on a point of information, I guess, was explaining, and she kept saying there's two, that they're going to submit two, and I wanted to know where is that in the bill?
I don't see it. We're going to take a moment's recess. Y minuto 35, the legislature in Guahan is back from recess. Senator Parrish, you still have the floor.
Thank you, Madam Speaker. Yes, in regards to this particular passage, I think from a procurement perspective, it's problematic. I mean, it opens up some questions as to if the subscriber chooses something other than what the governor chooses, and should there be a protest, who is a protest addressed to? That's another thing I was thinking about as well. But I think, for the most part, I think it's, how is this going to be implemented is a question in my mind. And, to think that the changing numbers of subscribers can affect the cost as well. And this is at a time when, we're in some sort of uncertainty with our fiscal stability. So during the recess, I understand that the author of the bill was seeking some clarification. Is that correct? Is there any more information the author has in regards to the questions that I have?
Senator Perez, if you didn't communicate with Senator Pito, restate your question then, please.
Yes, during the recess, I guess the question is was there further information the author can provide in regards to the questions that I posed earlier?
Senator Pito, do you have any more updates for Senator Perez?
Madam Speaker, I don't really understand what she's getting at. I really don't. So, I don't actually, whatever's in the bill, I can answer, if or not what the contents of the bill is all about and where we're going to. But as far as her question, I really don't understand, Madam Speaker.
Thank you, Senator Terlai. Senator Perez, you still have the floor.
Do you want me to recess, maybe? Okay, so basically what I'm asking is, so should the governor, should some government employees choose something other than the governor chooses? So how is that going to be implemented? Does the governor then have to contract with these companies that she did not choose? Is that the outcome of this particular passage?
That one I understand. I know that if they send the providers, all the providers that qualifies, they'll send all the providers, the names of the providers that went through the bidding process to the governor. But the governor would choose the most economical and the best, most reliable insurance, one. But if a subscriber wants to choose another insurance, then that's up to the subscriber. However, I want to say that the subscriber is going to have to pay the difference that is called upon by whatever insurance they choose.
Thank you, Senator.
I'm talking about the premium.
Yes, thank you. Senator Perez, does that help?
It does help, yes. But as far as the outcome, I think it's still uncertain because perhaps the premiums that may have been proposed might change with the number of subscribers. So I think, really it's kind of like the details, how this is going to work. I think it's sort of problematic for me from a procurement perspective. Yeah, and I think too that, being that the way the bill is written, the application is until after this current solicitation, I think it perhaps is, maybe wise to set this bill aside so we can get more definitive answers. I mean, I feel this is, since it's not going to affect the current negotiations, I think that, perhaps it require a little bit more work.
Senator Perez, is that a motion to set aside this bill?
Yes.
In order?
Yes.
There is a motion to set aside this bill. Are there any objections?
I object.
There's an objection. All those in favor to set this bill aside signify by raising your hand. Motion fails. Anyone else on the main motion? Anyone else? Main motion? If not, would you, Senator? Oh,
Madam Speaker, just as the previous bill and now this, with this bill, new bill number, I also request to recuse myself.
on the motion to excuse Senator Jim Moylan, are there any objections? Is there an objection?
Madam Speaker, if we could just have a reasoning as for the recusal.
I understand. I appreciate that, Senator Lee. Senator Moylan, can you please share yours?
Thank you, Madam Speaker. Recuse myself on, basically is on the business principle, there is a relationship with the insurance company that I am with. Thank you, Madam Speaker.
Thank you. On that motion, are there any objections? Seeing, is there an objection, Senator Therese, to that? Did you raise your hand? Are there any objections? Seeing or hearing none, motion carries. On the main motion, anyone else? Senate Minority Leader, I will recognize you.
Sijus Masi, Madam Speaker, and I'd like to apologize. I was looking at the previous 366 and was not looking at the substituted version. Now that I've had the opportunity to look at it, and it seems like most of the amendments that we made yesterday were intact. However, Madam Speaker, I'd like to proffer an amendment that I feel that the whole intent of this legislation is to allow for choice. Those who meet the qualifications, from there, the negotiating team provides to the governor of Guam. And at that time, Madam Speaker, the reason why I'm bringing this up on this amendment, which is FA 366 TTL 23 P3, is my amendment. I just want to make sure that it's clear that this is a choice. And this section here that was added back into the bill when we spoke on Bill 255, I think it was something that should have actually stayed out to make it clear that it is a choice. And what this bill does on line 23, page 3, to amend the bill to read, notwithstanding any provisions of law, rules, or regulation, the most economical and beneficial healthcare insurance plan, proposal plan for the government of Guam employees and retirees and foster children shall be defined at the lowest cost, period. And strike out option of either the exclusive or non-exclusive proposal. Madam Speaker, by striking this out, it's clear that it is defined as the lowest cost. But by providing option of either the exclusive or non-exclusive proposal, it almost makes it sound like you still have to choose an exclusive or a non-exclusive proposal. So the intent is just to make it clear that there's no questioning or who's ever looking at this law trying to figure out, is it supposed to be the best exclusive or non-exclusive proposal? So we're just striking that section out and just cutting it off where it was in the previous amendment that was proffered in 255 by good colleague from Dedito.
Thank you, Senator,
Or G vote.
Minority Leader. Thank you. On the amendment,
Madam Speaker,
Senator-
I can't find that amendment. Is that in the drive?
Yes.
yes, it is.
Under second reading?
Senator, Minority Leader, can you read?
Sure.
the-
It is in the drive under second reading, under the bill 366-35. Once that's clicked on, you will find my amendment titled as FA 366.
Sorry, now I see it. Thank
Okay.
you.
On the amendment, thank you, Minority Leader. On the amendment,
Oh, 1 minute, Madam Speaker.
Senator Lee, on the amendment.
Just Masi, Madam Speaker, just so I'm clear, I'm looking at an amendment to the substitute bill, line 23, page 3. And what's a little bit puzzling to me is the last part of this amendment, Madam Speaker. It says, shall be defined as the lowest cost, period. should that be lowest cost option or lowest cost proposal? It just seems a little bit unfinished, so I just wanted to raise that as a point of inquiry.
Yeah.
Senator, Minority Leader, would you like to yield?
Yes, absolutely, Madam Speaker. And the good senator is absolutely right. I think option should have stayed in there and not be crossed out.
On the amended motion to put option back in, are there any objections? Hearing none, motion passes. On the amendment as amended, anyone else wishing to speak? Senator Therese Terlaie, you're recognized on Senator Taitagui's amendment as amended.
Yes, Madam Speaker, this amendment is contrary, would controvert what the sponsor of the bill said when he substituted it on the floor, and there was no objection to the substitute, because he said it was going to give the governor the option of going with the lowest cost and most economical. I'm sorry, Madam Speaker, I'm going back and forth between these documents on our screen from the bill to the amendment. But, sorry, let me get back to the amendment. That it would be giving the governor the option of going with the lowest cost. And as Mr. Byrne told us when he was here and in the BBMR testimony, that it was proven in last year's negotiations, I guess is what they're saying, is that there is a difference between exclusive and non-exclusive, and that there was a savings last year of $11 million. So striking this, if this is to remove any choice from the governor, which the sponsor of the bill says that's what we're trying to do here, is give the governor that choice. If we're removing that choice from the governor, then we are very clearly mandating an increase in health insurance costs for, government of Guam employees and for taxpayers who are going to bear the increased cost. And this was, of course, this sentence was one that we had passed. It was one of my amendments to the bill that had passed on the floor, and I really think this is the meat. It is the definition of how you define the most economical and beneficial health care insurance proposal plan. And this is what Speaker Cruz worked, so hard on last term, was to get that defined, because it had remained undefined for many years and allowed governments pretty much to choose anything. And so this made sure that they were it would be defined as the lowest cost option of either exclusive or non-exclusive. And so this does not leaving this language in does not remove the choice from the governor, as the sponsor of the bill said, but taking it out very much removes that choice from the governor and very much mandates an increase in the cost of health insurance, like I said. And I just can't see that for we are not mandating a restriction on doctor choices for the employees. We are allowing this, the negotiating team to come up with, an expanded list of providers, doctors, specialists, but we need them. If we're going to keep the same benefits for the government of Guam employees, then we need to allow this negotiating team to have the choice, or to at least recommend, and that for the governor to have a choice of either exclusive or non-exclusive, because we've seen in past years the price difference of $20 million. Last year they said $11 million, and they've predicted, they said it in front of us, that guarantee it would be an increase if we remove the option of exclusive, Madam Speaker. Okay. So I very much object to to that amendment to remove this language, especially after we worked so hard on this bill the last time to put this language in to at least make the bill give the governor the choice, as the sponsor says that we're trying to do. And instead of removing that choice, we're going to tie her hands and we're going to restrict competition. And if you remove that there's no incentive left if you remove competition, Madam Speaker. Thank you.
Thank you. Anyone, Senator Lee,
This
on
is
the
Marcy,
amendment.
Madam Speaker. If we could just have a moment's recess.
Moment's recess. Y mina 35 in the legislature in Guam is back from recess. Senator Biscoli, you still have the floor. You're okay. On the amendment, anyone else wishing to speak? Vice Speaker Nelson on the Title Amendment.
Madam Speaker, the sponsor of the amendment is not here. We're going to proceed without her.
I apologize. A moment's recess. Thank you, Vice Speaker. Y mina 35 in the legislature in Guam is back from recess. Majority Leader, Vice Speaker Nelson, you are recognized? Or will I yield to Senator San Agustin?
Madam Speaker, I just want to speak on the amendment.
Please proceed.
Thank you, Madam Speaker. Madam Speaker, in Section 2 of the bill, lines 16 through 20, it says of the remaining qualifying plans, the employee or retiree, notwithstanding any other provision of law, rule, or regulation, choose one of the remaining qualified plans. Any difference in premium shall be paid by the employee or retiree at their own cost. And Madam Speaker, the proposed amendment is written here, notwithstanding any other provision of law, rule, or regulation, the most economical and beneficial health care insurance proposal plan for Government of Guam employees and retirees and foster children shall be defined as the lowest cost option, period. And as the previous speaker from Jonia mentioned, that this does two things. It takes away the authority of the governor to choose, and secondly, it does prevent competition. The first reason why is because already in the bill that we're already stating that the employees, the subscribers, may choose any of the insurance providers' options. That's up to the employee. So already allowing that avenue of choice. And then secondly, every insurance agency with this bill, or every insurance provider that wins these proposals, which is basically almost everybody, except for those that cannot avail to GRMC, will have a certain rate that the government will pay, and then the employee or the subscriber will pay the remaining rate. So it still provides the option of choice. With this amendment, it defeats competition, because then, as an insurance provider, there are other insurance providers with me, I can collude to increase a certain rate so we can all meet on that same level of rate, thereby eliminating competition. So I'd have to object to this amendment, Madam Speaker.
Point of information, Madam Speaker. Point of information. I just spoke with legal to ensure that what we're doing here is to continue in the spirit of this legislation, which allows choice. And according to legal, by taking this section out, does nothing other than to make it clear it allows for choice. Now, that's from legal. And this was something that an amendment that was actually put in when it was once 255. And when we sought legal advice on this, by incorporating this back into this legislation, it does not make it clear for choice. So this is based on legal's opinion, not mine.
Thank you. Thank you, Senator.
Point of order, Madam
Tide Green.
Speaker.
Duly noted. There has been an objection to the amendment. Vice Speaker still has the floor. You're still recognized.
Thank you, Madam Speaker. In the bill, it still says there is a choice, but it does not say what this amendment, how it will impact the bill. So there's semantics here, and I think there was a point of order, Madam Speaker.
And I will address the point of order. I was giving you courtesies, Vice Speaker. You have a point of order, Senator Therese.
It's just that if we're going to interpret legal, we're going to need to hear it from her, because we're using the word choice, which is not in the bill. And we're talking about all other kinds of terms here. And there's a choice by the governor, and there's a choice by the employees. The employees who are the subscribers, and there's a choice by the government, right, the negotiating team. So there's all kinds of choices that are going to be made during this process, and I think we're confusing those. And what I'm trying to do is not restrict the governor's choices, whereas some of the speakers are talking about choices for employees, which provider they're going to go with, which carrier they want to go with. So I just think that...
Duly noted. Thank you, Senator Therese. There has been an objection to this amendment. Anyone else wishes to speak on the amendment? Vice Speaker, do you have a point of information?
Yes, just a point of information that this amendment will limit the governor's choice.
I understand. You objected to the motion already. Anyone else wishing to speak on the amendment? Or Minority Leader, you can close.
Madam Speaker, I think the good senator from Georgia made something, probably a good idea for all of us to hear from legal. People are claiming here that it limits the governor's choice, and that's not my intent at all. So I think if we can take a short recess so that everyone is clear what legal's interpretation of this section is, and instead of just assuming, I don't think everyone is quite clear on it, and I'd like that opinion by legal if we can, Madam Speaker, so everybody understands.
We will have a moment's recess. Y mina 35 na la legislatura in Guahan is back from recess. Minority Leader, I will acknowledge you at this time.
Thank you, Madam Speaker. Madam Speaker, after speaking with after speaking with legal and my other colleagues, as well as the author of this bill, it is now under the understanding that by leaving exclusive and non-exclusive in this proposal, it still has the governor to be able to choose one carrier if she should so choose to have one. And if she so chooses to have one, it could be under the proposal of exclusive, or it could be under the proposal of non-exclusive, depending on what she wants. So this is totally different from the intent of what we've been used to for decades. The ability of having two individuals or at least multiple insurance companies coming forward. So it's a little bit different. So that being said, Madam Speaker, it still allows the ability for you to choose, even though she doesn't choose the one that you want, but yet still qualifies, you can still go under that insurance company instead of another one. So I know it sounds confusing because I was confused on this, but I'm going to withdraw my amendment in good faith because based on what I'm seeing here, it will still allow the government of Guam employees and retirees to choose their insurance company that they so want to go with. So I'm just going to withdraw my amendment.
Thank you, Minority Leader. On the motion to withdraw, are there any objections? Seeing or hearing none, motion carries. On the main motion, anyone else wishes to speak? Senator San Augustine, I will recognize you.
Madam Speaker, I have my staff drafting the amendment, but I can offer it now and then it'll come out if we recess till tomorrow. Oh, okay, 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 yes. Okay, then I yield to the Vice Speaker. Thank you.
Thank you, Senator San Augustine. Vice Speaker Nelson, on the main motion.
Thank you, Madam Speaker. I just need a quick recess to make sure to get it to the clerks to upload.
A moment's recess. Emina 35, en la legislatura en Guam is back from recess. Vice Speaker Nelson.
Thank you, Madam Speaker. Colleagues, this amendment is labeled as FA 366 TCN lines 9 through 11 PDF. And so it's crossing out the current wording where it says DOA director shall assign to verify the refunds or no refunds reported by the carriers. DOA staff shall verify the participating contract refunds reported by the carriers. We're crossing that out. And we are adding in place, the DOA shall hire an independent auditing firm to verify the participating contract refunds and no refunds reported by the carriers. And verification shall include validating claims reported by insurance carriers. In the 2018 OPA report, they estimated about $5 million a loss of revenue, or just a $5 million loss, because there was no validations for these refunds or no refunds from the insurance carriers. And so now, instead of having, we're hoping that a professional agency that knows how to audit properly these refunds and no refunds, that DOA will hire those personnel to do so. The OPA doesn't audit that piece of information. That's just what they found from their OPA audit. Thank you, Madam Speaker.
On the amendment, anyone wishing to speak? On the amendment? No. I'm going to call a moment's recess. Sergeant of Arms, where? The 35th Guam Legislature is back from recess. There is an amendment on the floor by Vice Speaker Nelson. Anyone wishing to speak on that amendment? Senator Sabina Parrish, you are recognized on the amendment.
Thank you, Madam Speaker. I just have a point of inquiry for the author of the amendment. I do
Please
support the
state your
amendment,
question.
first of all. I just wanted to verify if this would strengthen the complaint process. So, for instance, if subscribers have some issues with the current insurance provider, would this help to strengthen the process that we have in place to ensure that complaints are being logged and addressed?
Vice Speaker Nelson, would you like to yield?
From my understanding, when there are complaints, they first go through the insurance provider. And if it is not settled there, then the subscriber would move to the next step to go to Department of Administration and issue that complaint. This does not talk about customer service. It just talks about the refunds and no refunds given. So no, it does not address the complaint or customer service piece of the subscribers.
Thank you, Vice Speaker. Senator Paris, you still have the floor.
Thank you.
Anyone else on the amendment? If not, is Minority Leader, you are recognized on the Vice Speaker's amendment.
Si Diyos Masi, Madam Speaker. I remember, Madam Speaker, when we were talking to Mr. Byrne and asking the question, because in every contract they have with the insurance companies, there's what's called a performance guarantee clause, and it's supposed to be done quarterly. And I asked Mr. Byrne if there was anybody that had complained, because in this performance guarantee, it basically has fines there. And some of the fines that are given to the insurance company is if, one, their phones are not answered within a timely manner, and various other complaints. And we know through all these petitions and these phone calls that we're receiving, and believe me, when they call me, I say, well, your best bet too is note it, but you need to call Department of Administration and also file a complaint so they know that this is, they can log this down and follow through with it. So I was very, very surprised when I heard from Director Byrne that they have not implemented any fines to the current insurance company. I was really taken back and surprised. So I support this amendment, but I do have a question to the author of the amendment.
Please state the question.
So who's going to pay for this auditor?
Vice Speaker Nelson, would you like to answer?
The governments of Guam will have to pay for this audit. If it's a $100,000 audit, it saves the governments of Guam $4.9 million.
Senator, Minority Leader Tidegui, does that answer your inquiry?
So, okay, so the funding from this will come from the government of Guam. So that means an appropriation has to be made to this, or will it be part of the, because we spend $300,000 right now for a third party to review the proposals from all insurance companies. I'm just trying to figure out where that funding is going to come from. I know the government of Guam, but from whose pocket? Is it going to be Department of Administration? Actually, it should be.
Point of information, Madam Speaker, it will be out of DOA because
Okay.
they're the ones that are negotiating this piece, and they're the ones that should be tracking this.
Thank you. Duly noted, Vice Speaker.
Yeah, that's
Minority
all.
Leader, you still have the floor.
Thank you, Madam Speaker, and that's all I needed to know, whose pocket it's going to come from, and it's Department of Administration, which I think it should as well. Thank you, Madam Speaker.
Thank you, Minority Leader. Anyone else on the Vice Speaker's amendment? Anyone else? Is there an objection? Would you like to close, Vice Speaker?
Thank you, Madam Speaker. Colleagues, I ask for your support on this amendment. If we implement this process, we will save the government millions of dollars. And so it is a small amount to ensure that the government is receiving and tracking the refunds and no refunds for the millions of dollars that will be saved, especially when we are dealing with a $100 million contract. Thank you, Madam Speaker.
You're welcome, Vice Speaker. On the amendment, are there any objections? Seeing or hearing none, motion carries. Vice Speaker Nelson, you still got the floor.
Can I get a quick recess? Madam Speaker, there's another amendment that
We-
a colleague of
a
ours would like
moment's
to
recess.
upload.
Imina 35 na legislature in Guahan is back from recess. Senator Joe San Augustine on the main motion.
Madam Speaker, I have an amendment. It's identified as FA 366 JSSA, line 12, page 3. And the amendments to read on line 12, to strike the word all and add the 3 highest ranking qualified proposals. Switching the all to the three highest ranking. And the reason for that amendment will ensure that the 3 best proposals, as determined by the negotiating team, are sent to the governor, still allowing subscribers to elect their choice of insurers, but it will only permit the top 3 to serve as the choices for subscribers.
Thank you, Senator San Augustine. On the JSA amendment, anyone wishing to speak? Anyone? Senator Chalayi, do you have your hand raised, or?
Yeah, I'm trying to find the amendment, Madam Speaker.
It's listed as, you got it? All right.
Senator Will Castro on the amendment, you are recognized.
I want to state my support for the amendment, Madam Speaker. Thank you.
Thank you, Senator Castro. Anyone else on the main amendment by Senator Joe San Augustine? If there's not, anyone, are there any objections? Hearing none, motion carries. Senator San Augustine, you still have the floor on the main motion.
No further amendments. Thank you, Madam Speaker.
Anyone else on the main motion? If not, on the main motion, Senator Terlahi already spoke on the main motion. It's either Senator Marsh Taitano on the main. Colleagues, just as a refresher, those who spoke on the main motion are Senator Lee, Senator Nelson, Senator Paris, Senator San Augustine, Senator Taitagui, Pito opened, and Senator Therese. Anyone else on the main motion?
Point of order, Madam Speaker. I did not speak on the main motion. I proffered amendments. I did a point of inquiry, point of information, but I did not speak on the main motion.
Ma'am, when I asked on the main motion, you were addressing, you said I had an amendment to proffer. I got this from the clerks. I just want to notify for the record, so. I'm going to take a moment's recess.
I see.
The 35th Guam Legislature is back from recess. Anyone else on the main motion, please? Senator Will Castro, I will recognize you on the main motion.
Thank you. Sujusmasi, Madam Speaker. Madam Speaker, ay dispensa bay hu tatsagi nina sinahogi finota. Fernando size dia Tati hu gitalawani hu recibi itinigan principat put esti na priniponi. Bill 366, which was once Bill 255. Zanyo et mas gehilo hago no mas untungo umatungo ham zanesti no kilisdano si Senador Pito Terlahi staba mahot gizotnya gino temponya ges Zan si Angit Santos na malalago idos pagabetno. Guaho no mas tumungo na go sincero esti na kilisdano anai hu taitai I katanya, hutunga no go sincero gui, hutunga hafa kumekeleknya, hutunga hafa no sasangan. Japut estina rason hu tatsu, zabai hu sopopote estina priniponi. Put guaho estino a choice bill. So, Madam Speaker, I want to thank you and your staff, and also Speaker Pito Terlahi and his team for working during this time of uncertainty. And while most certainly not the most ideal of working conditions, I am proud that we've been able to keep the task at hand by working collectively and collaboratively. And by maintaining this course of professionalism as well, Madam Speaker, it's my privilege to rise and speak in favor of Bill 366. Sin hafa masam, to put it simply, this bill gives the families basically the power of choice to choose a medical plan that will protect them and their loved ones on island and abroad. This bill would allow them to choose a medical plan that gives them peace of mind during this crisis and during this pandemic. But most importantly, in summation, in my humble opinion, it gives this family or those families the right to choose their medical plan. And unfortunately, Madam Speaker, during this ongoing pandemic, many families still face the difficulty of having to choose between one priority over another, between food, and we heard earlier discussions unrelated to this specific bill, but it's consistent throughout these deliberations this past week. The families are having to choose between food and medicine, utilities, loans. I mean, the list goes on. And who am I to judge which of these priorities are at the top of the list? Señora Etmas Gehilo, Bula no Tautauta, man mama dedesi pago na tempo. Pues mailafan, ufafaisan hamsu con respeto, mailafan zata akudi, zata na ajudazi siya. Let's give our families, those who are already dealing with the hardship and tough decisions, the ability to choose with optimism and with confidence what works best for them. Senator Terlahi, Bill 365, as I rise in support, in my opinion, is a huge step in that direction. And I want you to know that I stand and I reiterate my support for this measure. Sujus Masi, Madam Speaker, Senora Etmas Kehilo, Zan Parahagolokwi, Senador Pito Terlahi. Sujus Masi.
Buen provecho, Senator Castro. On the main motion, Senator Luis Muñoz, you are recognized.
Thank you, Madam Speaker. I rise in support of this measure with this bill, Bill 366. I support choice. We heard that choice will cost the employer more. I don't believe it will. The cost of health care services and medication will not go up if people have choice. The premiums on some plans may go up, but if any plans' medical losses do not reach 86% of their premiums, they have to refund the excess to GovGuam. The late Speaker, Ben Pangilinan, worked hard on the law that gave employees a choice. In the choice option, since all benefits and coverages are identical from each insurance company, consumer choices are based only on the quality of the service. That's all employees are demanding when they ask for choice of health insurance companies. I rise in support of this measure. Thank you, Madam Speaker.
You're very welcome, Senator Muñoz. Anyone else on the main motion? Senator Therese Terlahi, you.
Thank you, Madam Speaker. Access to health care is a concern for every man, woman, and child on Guam right now. And it's a very important issue to me and the Committee on Health, Madam Speaker. We have been told by the Department of Administration that if we force multiple contracts, as opposed to the current law, which gives the choice of exclusive or non-exclusive contracts to the negotiating team to rate and to determine which is the most economical and beneficial for the government of Guam employees. So if we force multiple contracts, without allowing the negotiating team to do that type of an analysis. According to Mr. Byrne, we are looking at, based on last year's rates. And I don't think anybody can expect that we're going to get the same rates that we got last year. I expect them all to go up because of what we've all experienced, especially the health industry. And but according to Department of Administration, that we would have paid last year a minimum of $11 million more if they were not allowed to choose the exclusive. The negotiating team must be able to negotiate for the best deal. It was not a sole source contract or a sole source procurement. I've heard some radio stations say that, and they're wrong. It was not a sole source procurement. A sole source procurement is what they did with the hotels when they went to one hotel and said, we want you. That's not what they did here. They made these companies compete, and that is what we always want in government procurement. We want competition, fair competition. It was not a monopoly. I've also heard that from some people. It's not a monopoly when you win the bid. You win. And of course, you provide the services. Otherwise, if all winners were determined a monopoly, then every contract holder on Guam would, we could call them a monopoly. It's just silly, of course, but it's not a monopoly. We have competing carriers, and we want competing carriers. We want always to have competing carriers, and we don't want to chase them away, because the more competition, the better for the government of Guam employee. Every member of this body, and maybe every member of the negotiating committee, might prefer a different company, even me. And we would base that on different things. But what we want our negotiating team to do is to base it on, the criteria that they put into the RFP, the criteria, the benefits that we have mandated, that we want our employees to have. We want it to be as objective as possible. That's what we want for competition in our procurement, Madam Speaker. The 34th Guam Legislature, when they decided to define the most economical and beneficial, added in the definition which included the words, the lowest cost option. And that was meant to curtail the spiraling costs of the government healthcare contract during a time when payments were millions of dollars in arrears, and contributions for retirees were not being met. And at that time, they were expecting a $13 million shortfall, and then the Trump tax cuts came, and the shortfall was tens of millions. So they were trying to save at what Speaker Cruz calculated at that time was an average of $20 million between exclusive and non-exclusive contracts. The new law that was passed last term did not exclude choice. It simply mandated that the lowest cost option, whether it was with multiple carriers or an exclusive one, is going to be the winner. It incentivized competition. The inability to continue to afford the largest contract entered into by the government of Guam, which is over $100 million for health insurance alone, is a potential threat right now to active employees and especially to retirees. The impacts of legislative intervention in this procurement process will have negative consequences. And so I'm glad that that part of the bill was changed so that it's not going to take effect during this current negotiations. And while I recognize the current issues, there are issues, Madam Speaker, and I've taken all calls, emails, and I recognize these. And these people, when they need health care, these issues are a matter of many things. One person said life and death. One person, they're a matter of health, right? And so, of course, we want our negotiation team to ensure in their negotiations that we are going to have a carrier that is responsive, a carrier that is going to be prompt with reimbursements, where pre-approval for referrals to specialists or for procedures is done promptly. And as promised, all carriers will provide the network that give the patients the widest choice of doctors and specialists. That's what we want. And we want, if our carrier is not doing what they've promised to do, then we want the Department of Administration to step up and to enforce that contract and to do whatever it takes to ensure that after one complaint, two complaints, that no one else would have to complain, Madam Speaker. And so we need to give our negotiating team the tools to do this. As we all know, many of our residents have lost their jobs or have had their hours cut, and subsequently, medical coverage for themselves and their families have been cut. And we need every dime we have to ensure that we can pay tax refunds on time, we can pay for food assistance. If the federal food assistance is running out, we can support those who may become homeless. We support even shortfalls that we can't foresee, and shortfalls that are being carried over and exacerbated in previous budgets, such as capital improvements at the hospital or the $700 million estimate that the Army Corps has given us to build a new hospital. So we must do what is fiscally prudent and share these economic hardships by making the hard choices in prioritizing taxpayer dollars to ensure access to health care is attainable for all of our residents and the future of our island is secure. Since that law was passed in the prior legislature, prior term, more people are unemployed, and the government is expecting to see even more of a shortfall in revenues. So during this financial crisis, all of our residents, all of them are using their scarce resources to provide for the most basic needs of their entire family. No luxuries. And the government, we must do the same. We are covering all benefits as in previous contracts, and we must incentivize competition, Madam Speaker, and try to save money if we can. And without cutting benefits, I think it's a big task for the negotiating team, but I think they can do it, Madam Speaker, and they've shown us that they could save $11 million. So I just want to thank you very much, Madam Speaker, and thank you.
Senator Therese Terlai. On the main motion, anyone else? Senator Kelly Marsh, I will recognize you on the main motion.
Sejus Maasi, Madam Speaker. I have both a question and then some comments.
State your question, please.
So with the question, I've been trying to find out for several days. I've had discussion with Mr. Byrne, but I still have not received the list of the autonomous and semi-autonomous agencies that this bill would fold in. And the reason that I bring this up is with a bill that is talking about choice, it strikes me as counter to that to take some of these smaller entities that maybe have 5 employee or staff, or maybe 30 employee or staff, that won't make a large difference on the bid, but their option to continue to have their choice may still be something that they really hold as important. And so I struggle with the concept of, in the name of choice, to take away their choice almost absolutely for a plan that they feel that benefits them. So I'd like to ask the author or anyone else here if they have ever gotten that list of autonomous or semi-autonomous agencies, public corporations, and authorities that we would be folding in this time if we have an understanding of that list. I've heard opposite things. One person said Gita has a choice, the other said they do not. One says that some of these other entities, like the Guam Preservation Trust, have a choice. Others have said not. So I'd like to know if there's an absolute list so that I can make it an informed choice.
Senator Marsh Taitsno, I have the answer to that. I think Senator San Augustine can also, she wants a list of all the agencies that are in the insurance pool, and the only one that's not in is, you know the answer, Senator Joe, please provide that.
Yes, Madam Speaker. For our colleague, only the judiciary is not included. All agencies are included.
Even the autonomous agencies.
That's
please
correct.
note that for the
All
record.
GovCom entities.
Thank you very much, Senator San Augustine. Senator Marsh Taitsno, does that answer your inquiry?
Yes, that's very helpful, and it's, like I said, it's something that I've been seeking ever since last week when we had some of those questions. And so it allows me to understand what effects and impacts we are or not imposing. So there's a lot to weigh out in this bill, and I've been appreciative over the last week or so for all the input and all the questions, all the queries, the committee on the whole. It was important to go through all of those steps because there's a lot to consider here. There's been a lot of thoughtful discussion and questions. There have been points that have caused me some concern, which is why I'm still thinking these issues through. I do agree with the authors that there is nothing more precious than the health of our families and our fellow community members. We are both an employer that takes into consideration GovGuam employees who worry about being able to afford medicine and treatment, as well as being able to access programs for members of their families who may be fighting cancer or seeking to access a program for their child with autism. As has been mentioned previously by other senators, this must be balanced, of course, because we have the responsibility of looking out for the needs of the entire community. I remember testimony for previous bills, people expressing that for them, each and every dollar of additional cost in insurance was a worry, that they were struggling already, that they didn't want to have to start making choices between medication and other needs. For every dollar of additional cost that just occurred with this last round, by adding on GRMC and the natural inflation of healthcare, because of the lack of data at this point, it is unknown the potential fiscal consequences. This bill could require those very same people who were worried about that extra dollar to have to think about additional dollars. If implemented, the fiscal note has said that this choice comes at a cost, that it could have the consequence of making insurance unaffordable to some, if not many, of the very government workers we are trying to serve. As was testified by the negotiating team itself, the full data that we need to understand this year's situation and even understanding what the issues are has not even occurred yet. We don't have the full data to inform us of what needs to be addressed. We also don't have the data to understand the percentage of those that are dissatisfied with the current process. We saw a petition of 1,500 people, and 1,500 is no small number. And I don't think there's a person here that takes that lightly, whose heart doesn't go out to those hardships that have been experienced. DOA testified that nearly all the cases presented to them have been resolved. And so right now we don't know to what degree that does or does not correlate with that petition. The others beyond the 1,500, the other 40,000 or so, is also a large number. That is the number of those, in a sense, that we haven't heard from. They make up 96% of those under the government health care plan. With incomplete data at this point, we have to ask ourselves, do we really understand the situation? Do the 96% support potentially paying more for insurance? We do not know. To make a decision that affects them, I feel we need to hear from them. If they support it, then that's the data that supports this bill, that we can then be more comfortable with having the assurance of their support. By all accounts, if the entire universe of subscribers and dependents is not part of the pool, the costs will be more. We also don't have a clear fiscal picture. Maybe in the big picture, $11 million doesn't seem like such a big issue in an $800 million budget. But we have no data right now on what our budget will look like. This year, we're looking at potentially having to shave off $40 million. What will next year bring? Federal assistance may be over, and the economists are telling us it may be 2 years or more for our economies, including tourism, to recover. There was an article just this morning that if we have our island-wide cleanup, if we get our tourism in order and we open up our borders, we may not be having anybody in for still quite a while. What we do know is having $8 to $11 million less for education, public safety, and healthcare is something to think about long and hard. Will government employees in our community be okay with having $8 or $11 million less for textbooks and getting students digitally connected as we provide educational changes? Will government employees in our community be okay with having $8 to $11 million less for police officers on our streets? Will government employees in our community be okay with having $8 to $11 million less for hospital repairs? Our MIP program is currently at $19 million, and it is short in taking care of the healthcare needs, as we know. We also will have less for those that are most vulnerable, including the children who are part of homeless families. We want to do what's right, but in order to do so, we need to make informed decisions, and we don't have the data. If we support this bill, I call on everyone who votes in favor of it to search just as long and just as hard for solutions for the health care of the whole island and the other financial issues that we are having. Sujus Maasi.
Thank you, Senator Taichino. On the main motion, anyone else wishing to speak? If not, Senator Pito Terlahi, you can close on your bill.
Madam Speaker, dankuluna na si Jesus Basi. Dan ay komento si Senator Castro za pemlut Samoro. Luhanzo sa jur latia fa pausangan. Lo maila za bay antes de bay hutu mestina kwentoso. Zao na bay nai si Subrinao, si Senator Terlai, and Toru Samjun ni man halum sa paguno li na manita gihinaso. Jang intabira no gifino tomorrow. The session that we had in previous days, I can trustfully say, unu pa mamparewit na hinasu, yo truta tungua, zo sangana gifinena na kwintosu, anay komentosu podestina bill, hafay rason naman malagwit para senidor. Jo tungua na todit gizahita, man malagwit, gwini na presto, iparatas empenyo para tajuray tau-tauta. Gifut mat. Jo tunga nagwaha siya kung kurahi, zanafa siya na amendment. Lost tayo jo dispensa siya sa fina mauli kasi na biyo, nedyo siya i-amendment ni mafatinas. Benay dangkulo na si Diyos masi todo iman gwagi gini na piso. So ulihin naman akong prendit. Ulihin naman gagi kikoroson mizo. Para ta opi. Siya itauto ni man manggagagaw nesti na judo. Jo tungua nonggan sina mas gasto. Lo fera dia now. It mas importante ni para tabota este nabil ipofan satisfecho itauto ni ginagaw niya. Jakin imprendeku distik ta diskuti este nabil huli na kana todo disit gwini ta komprendi hafa kumbekilig na este nabil. Ja edzun na magufo na dia. So, li na manafaksay hinaso. Para tatsogi, hafa malago niya itaw-tawta. Ja edzigi malago niya po, fan manay lugar sa pamaadzik of financiers. Ja estigi na leku, jagin tabota esti leku na hunggan. Madalaki, iminalago itaw-taw. Sabi na ayaw loki, Madam Speaker, dangklo na si Diyos Masi. Sa kumutiha ko, 22 falofan. Esti sa ikwentus ni maajudas ti na bill, i-366. Sa dangklo na si Diyos Masi, sa talo besang na, si Diyos Masi, subinaw, sa edja, tatungo zona rules. Si Zeus Masi, Senator, todo sanjo, jangin haji malago, dumalaki sti para ko, chair, por favor, nayam ni finomizo dan speaker za tapega hamzo. Sa uno, sanya tafa maulik, ta spempenyo para ta juray tauto, ta hamzu lokwi, man masangan hamzu. Sampai ni tauto nonggan gagi koroson. Nat mas 3 kilo na nasota. Eji talangnus ni finota para ta juray tauto. Si Diyos Masi, Madam Speaker.
Senator Pito Putfootball, can you please move it to the voting file?
Madam Speaker, thank you very much.
On the motion to move the bill to the voting file.
I move to place bill number 36635 as substituted on the floor to the voting file.
Third read. On that motion, without any
Thank you.
objections, motion carries. Majority Leader,
Madam Speaker, I'd like to request a recess to come back at 10 a.m. tomorrow. Just one note, if we could make a motion when we come back to vote for our confirmation of nominees that we have, if we can vote on that and then go back into session with the regular bills, but if we can make that at the top of the agenda, I'll make that motion tomorrow just for the record. Thank you, Madam Speaker.
duly noted.
Madam Speaker, can I say something too? I would like this particular bill 366 to move on and to the earliest possible date for its
Duly noted,
implementation.
Senator Pito Terlahi. On the motion to recess, we will be in recess till 10 o'clock tomorrow morning. Good night and be safe, colleagues.